Today, what I'm going to talk a bit about is anaphylaxis. Anaphylaxis is a severe allergic reaction, and it's what happens when someone either eats something they're allergic to, takes a medication they're allergic to, or gets stung by a bee that they're allergic to. Anaphylaxis is a life-threatening event, and it usually involves at least 2 organ systems. It involves usually the skin. Almost all of our patients will break out in hives, have a rash, and then something else will happen. The most dangerous is if they start having breathing problems. They can have coughing, wheezing, shortness of breath. Sometimes if it's a food, they can have diarrhea or vomiting. If it's a bee sting or medication, they may have true severe anaphylaxis in that their blood pressure drops, they begin having trouble breathing, and that can actually be a fatal event. Identifying anaphylaxis is important because we have an amazing treatment for it. That's where the AVQ or the EpiPen can almost immediately eliminate anaphylaxis if we diagnose it quickly enough. That's why all of our patients who have severe food allergies or who have bee sting allergies will have an AVQ injector or an EpiPen to use when that happens. It's what we're trying to avoid when we are trying to deal with the new treatments that we're going to have for food allergies. Food allergies is a very exciting area in the field of allergy right now, as we are on the cusp of having some new treatments. For all the years, what we've been able to do when people have severe food allergies is avoid the food they're allergic to. Now, in the near future, and near means the next 6 or 12 months' time, we're going to have either a patch or an oral immunotherapy in which we're going to be able to make patients who are severely allergic to peanuts less allergic. In the future after that, once that's approved, we're hoping to have a patch or oral immunotherapy, that's an oral tablet, where we'll be able to try to prevent tree nut allergies, shellfish allergies, and eventually milk and egg. That's a very exciting time for us, and hopefully this will eliminate anaphylaxis from our food allergic people. Right now, we do have a treatment for bee venom allergy. So patients who have severe allergies to bee stings, and again, this can be fatal, and upwards of 100 to 200 people a year in America die from bee stings. So it's a serious problem. Once we identify the people who are allergic, we can actually put them on allergy shots to the specific bee, whether that be a yellow jacket, a hornet, or a honeybee, or even fire ants down south. We can desensitize them or make them not allergic through a series of immunizations. It can be as quickly as about 18 shots, and we can make a patient safe and be able to go outside and not be worried about having a fatal event.